O te mwai whātulou, ma o whātalo whātu I le nei tai au fou, I le paia ma le mamalu o le tātou atunuu. O paia ma mamalu o le a o le toe, o iai a wā o sāma whaingā, e mai le vavau e o lava I le whāvavau. Ai tau I ona o whātulou, tulou na lava. Whātalo whātu I le nei tai au fou, tai au tutoa, tai au manino I le alofa ma le anga le lei o le atua. Ma leifua mai o le mamalu o le atunuu, malu o le au whainga luenga, tai o le atunuu. Vi ia le alofa o le atua o na ua whapopo foi le nei aso, I le soifua ma le ola o si o tātou atunuu. Wa iai le finangalo I le komiti whaafoe o le fionga I le kovana, ia ua te tau foi o na mātou o mai, ia e avatu se whaamatalanga I tūlanga o ngā luenga na whianga iai le whainga mālo I le nā foi vai aso ua tuanai. Good morning, American Samoa. It's an honor to be here in front of you to provide yet another edition of news on the work conducted by the governor's task force and the EOC and your government regarding our COVID-19 community surge now in effect. American Samoa is in the early stages of its Omicron COVID-19 surge. This surge started on February 21st, 2022, when 8 people in our community were confirmed and tested positive. Today, March 21, marks the 29th day of our community surge. So far, we have recorded a total of over 1,500 positives, but no fatalities. On February 22nd, our Honorable Governor Limanu's declaration of a code red: mask up, social distance, vaccinate, and this surge that we are currently in, projections. They're not actual things that will happen, and our prayer is that we can improve our case as we gather more information and as we get more people to get vaccinated and get tested and treated. These next 2 weeks will be our toughest. I pray that our community, our leaders, government leaders and church leaders, village leaders, that we continue to lead our community in peace and calm and keep the faith. This will be the time for us to stay strong and come together and support one another. And it will not be the time for us to point fingers and start to divide. I want to acknowledge the support of many community groups who are doing things in the community to help your government control the spread of COVID-19 in our community. Churches, the Congregational Christian Church of American Samoa, who conducted a week of prayer last week. I want to acknowledge the Give Light effort that is done by some members of our community to help our people who are experiencing power outages. I want to also acknowledge the leadership of the Fono, the Honorable President and Speaker of the House, and all members of our Fono for your leadership and for your prayers and your support of the Governor's efforts to control the spread and to control the issues with COVID-19. We cannot do this alone. With your help and your assistance, we can do it together. Now, I'd like to turn over to our presentation today. First will be a presentation from the Department of Health to give you an update of our work, and then followed by the LBJ folks who will give you an update of the situation at the hospital, and then following that will be an opportunity for our federal partners, Allison Flander, to give you an update of the work that they're doing to address and help us address the COVID-19 surge. Finally, the Attorney General will make his presentation further explaining the terms of our current declaration. With that, I turn over to Director Mutusa. Lo fionga Mutusa, ia le manoa nei mo le tātou mtanga luenga o le soifua maloloina.
Whātulo atu le mawalunga mal mapuapu e o le nei foi tu lao le aso. Tu sai foi o lau whasausaunga, e o mai foi o lau fionga le car ai mesha le mamalu o le au taitai o le malo o e foi o loo a wai mai tu sai foi mai nei press conference. Whātulo atu le nei tai au. Good morning and welcome to the press conference this morning. This is Public Health reporting from our headquarters in Tafuna. Dr. Lauvao, Dr. Ifili, and Dr. Moore are standing by at the EPI surveillance headquarters down on the first floor. This time, I will turn the floor over to Dr. Ifili and Dr. Lauvao in regards to a quick overview of what's been transpired the past 24 hours, and also our total test, treatment, and also vaccination, the status of our search for your awareness, and also your planning to include the projection of what's going to happen sometimes in the future. So without further ado, I would like to turn the floor over to Dr. Ifili and Dr. Lauvao. Over. Dr. Ifili.
Thank you, Director. I'll turn over to Dr. Ifili now. Thanks. Over.
Talofa lava to American Samoa and all the viewers and listeners participating in our press conference this morning. I'm going to give a quick presentation on the situation of what has happened in the past 24 hours, and then also our cumulative numbers, how many positive cases we've had since the beginning of our outbreak from the 21st of February. Next slide. Currently, we'll talk about vaccinations first. We have accounting 40,911 total individuals that are fully vaccinated. That comes out to about 82.3% of the total population, or about 90.5% of the eligible population. These numbers are very good compared to other places that we've seen around the world. And this is how we will be able to protect our people. Vaccination and boosters. It shows that if you are fully vaccinated and if you have the booster, your risk for severe disease and hospitalization or even death is greatly reduced. So we urge the public to please take the time to come out, get vaccinated, and get your booster shot. As far as our COVID-19 cases updates, yesterday, the Department of Health did not have any sites for testing and therapeutic treatments open. It was only at LBJ where samples were collected. 174 samples were collected, and of those 174, 55 new cases were identified. That brings our cumulative number to 1,565 total number of cases. Hospitalizations, there were 2 new hospitalizations, and current hospitalizations that we tracked is at 8, but I will allow LBJ to further elaborate on this and to go in more detail. As far as those who are released from quarantine, 15 were completed their 14-day cycle or days for isolation after testing positive. And the total number of those who've completed their 14-day isolation process is now at 231. I'm glad to also announce that after going on 5 weeks of this current outbreak and surge, we still have no deaths in the territory. Next slide. Tracking the virus and where the individuals, the 1,565 are coming from. If you look at the map here, the darker the color of the village, that means the higher the percentages of cases that is coming from. So if you notice that it's here in the Tualauta and over at the Ituau and even the 4 districts villages in that area where we have the highest concentration of population. That's where majority of the cases are coming from. However, if you look at the map from the west side or the left side of the map, all the way to the east side or the right side of the map, the virus has canvassed the entire island. It's spread throughout the entire island, and we expected this. The SARS-CoV-2 Omicron variant is very transmissible and moves really quickly. But in order for us to stay safe from this infection and disease, it's very important, like what the Lieutenant Governor had mentioned, that if you do feel symptoms of COVID-19, that you should please don't wait, come in, get tested so that you can be assessed for treatment. There's a fine window for these treatments to be given to really reduce your risk of going into the hospital or going into severe disease or death. So please take the time, look for your symptoms. If you're symptomatic, come in and get tested. Also, we need to get the vaccinations going. Vaccines and your booster shots will really help protect you from severe disease. Next slide. The next slide here, we're going to be going into talking about our projections. But before we go into that, we're looking at the slide here. This is looking at the number of cases that we've detected from the first day that we started the outbreak on the 21st of February, all the way up until yesterday. And if you see here the trend, the bars here, the bar graph here, you see it's on an upward trend. We are in a surge currently as we speak. The red line that you see here tracking alongside the bar is what we call the 7-day case rate. The 7-day case rate is a number that we calculate so that we can compare how our outbreak is going to other places in the world. So this number is calculated by taking the number of cases that we've seen in a 7-day period and divide that by our population. And then, we multiply that by the population, and then we actually divide by the population, we divide by 100,000. So it's similar to calculating a percentage, but the 100,000 mark there is that so we can compare these rates to places like Palau, Guam, and Hawaii. Then it will be used to calculate our projections. Next slide. So using our 7-day case rate, we are now able to use this to calculate how many cases can we expect going at this certain rate for the coming days. The black dotted line you see there, that is the weighted projections or looking forward, how many cases that we expect looking forward when we compare or we use weighted projections from Palau, Guam, and Hawaii. And so we use our 7-day case rate to put on top of that rate and see how well we're tracking with the black line or our weighted projections. And with this, we can calculate the estimated number of cases we can expect per day. And when we calculate this, the expected peak time for our outbreak, given the particular pace that we're going on right now, the peak is expected at the ending of March or the beginning of April. And at this time, the number of cases are expected to be anywhere from 240 to 250 cases per day. At this rate, I'm sure, like what the Lieutenant Governor has said, this is going to be some of our toughest times. We can expect a huge surge of people coming into the hospital and even at our test centers. So we ask the public and the community, please do your part in this time, very difficult times we're about to embark on. Check out your symptoms. If you become symptomatic, come out to one of our sites to get tested and assessed for treatment. It is these treatments that will help us reduce severe disease and hospitalization so that we can minimize the number of people going into LBJ. Lastly, with this projection, we can expect that by the beginning of May or even the first week of May, our numbers will be coming down to levels where hopefully will mark the ending of this outbreak. And okay, next slide. Let's look at some of our schedules for this week. Vaccination will be at from 8 a.m. to 4 p.m. Monday to Friday at Pango Pango and Tafuna Diwa. Homebound teams are set out on Wednesdays to Saturdays. And then also this Saturday, we are going to be doing another drive-through at the Whangatongo Marketplace from 8 a.m. to 2 p.m. So please, if you have not received that booster shot, this is where you can go and get those shots. And if you're not available throughout the week, you can come to one of our drive-through sites at the Whangatongo Marketplace. Be in your car, in your comfort of your car, and get your booster shots. Our testing sites at the DOH locations is from Monday to Friday at the Amauli, Tafuna, and Leone Health Centers from 8 a.m. to 4 p.m. On Saturday, we will be opening only one site, 8 a.m. to 2 p.m. at the Tafuna ACF1. Next slide. For our vaccinations, next slide. This is what happened this past weekend. Very happy to show these numbers. At the Whangatongo Marketplace, we were able to administer 521 doses. Majority of those doses, 456, were of the booster shots. And our homebound teams going from house to house also put out 243 doses for a total of 764 doses this past weekend. Next slide. Now, if we look at our total coverage for the entire population, we're estimating that about 82.3% of the entire population have had their fully vaccinated, and about 87.4%. Director Nua, thank you.
Thank you, Dr. Ifili, Dr. Lawal.
Out of that, 56 patients turned out positive,